Okay, hello everyone. Welcome to this last week of new lecture material. Effectively, this week it's meant to be a little calm week as far as new materials, since the past few in this compressed course have been very jam-packed with new material, and you've all been doing very well and keeping up with everything from new material in physics, from vectors, force and torque, interpreting motion plots, going all the way into, let's see, circuitry, how it compares to the nervous system and cardiovascular system, going from thermodynamics as well, and osmosis, diffusion, getting into, oh jeepers, ray optics, wave optics, how light travels, how radiation travels, whether it's or how waves travel, whether it's hearing, sight, sound, vision, things like that. Well, all those have been jam-packed, and you'll see some of last week's material on this upcoming exam for this week, where there's only going to be two, I believe, two math problems and mostly multiple choice, like that a few weeks ago where it was almost all math problems. But the new material, very short, very simple. Essentially, we're going over 6 different types of medical imaging techniques, which are ultrasound, radiography, CT, MRI, SPECT, and PET, which, if you expand the last four, computed tomography, magnetic resonance imaging, single photon emission, computed tomography, and positron emission tomography. Essentially, just as one last quiz for this week's material, just take those 6 techniques. You can even shorten some of them, like positron emission tomography. You can shorten that to PET. You can use SPECT for SPECT. You could even write MRI or CT in place of writing the full name for those two. Essentially, for those 6 techniques, we're just order them based off of the lesson given. The video short, the PowerPoint short for this week. Essentially, some of those 6 techniques you will plug based off of whether they give structural information, and of those 6 techniques, some of them will go in the functional imaging part, just write their names as appropriate. Functional, that just means we see activity. It can say whether part of that body has died because there's no activity there, or perhaps there's a lot of activity which indicates cancer in those regions, versus structural information just gives the scaffolding, the physical information shown. And then two-dimensional and three-dimensional, some of those techniques will give us imaging information that is in the 2D frame, where some of them give us information that's in the 3D frame. For all those 6 techniques, let's just say if you put ultrasound on one side of our chart, don't put ultrasound on the other side. Same thing for here. For each of those 6 techniques, wherever you put radiography, only put it on that side of the chart. Do not put it on both sides of the chart. Same thing for CT, MRI, SPECT, and PET imaging, PET imaging, PET scanning. Just as a little help for the first comparison chart, most of your 6 techniques, they're actually structural imaging, whereas a few of them are functional. And for your 6 techniques, most of them are actually 3-dimensional, and then there are a few that are 2-dimensional. In any case, this week, basically, take it easy. Your exam covers last week's material, but this week, the new material is pretty calm, pretty casual. You've done a lot of work to get to this point. So as this week comes to a close, your final exam will start immediately next week, and you'll have just a few days to do that final exam. It will be, once you have a few days to decide when to start it, but once you do, you must finish it within the allotted time for that exam, for that final exam. and it will be cumulative, but sort of like all of our prior exams, for the most part, they're going to be mostly multiple choice. In your final exam, I believe there's only about 2 questions where you have to make a calculation. In any case, yeah. So just a little heads up that while most things this semester have been due by Sunday, your final exam will be due much, much earlier in the week. And if you don't do it, then that will be reflected as a 0 as we get into final grades. But you're all doing well. Glad to have you all. Looks like you're all going to pass and continue on in your program. Most likely I will not have you again for a class in this program, but glad to have had you all. If you'd like, I'll probably keep the same email, or I can tell you my main email for the college that I work at full time. Would be glad to hear how you're all doing, how you are doing in your programs after you finish the program, where you decide to go, whether to stay in the speech language pathology program here or physician's assistant, optometry, wherever this class takes you. Glad to have had you all for this class, for the short physics class, biophysics class. You're all done very well, and not to belabor the point, just glad to have had you all in this short semester. In any case, peace.